Next, we have a community spotlight on some great work being done by the Hawaii Children's Action Network, the Department of Health's Medical Reserve Corps, and incredible community volunteers to assemble face shields for healthcare providers. Let's take a look.
So the intent of this project is basically to make or create all the face shields that we will be providing. When I say we, it's basically the Department of Health who purchased the face shields, and these are PPEs that we will be eventually distributed to healthcare facilities. The Medical Reserve Corps are the volunteers that are basically managed by the Department of Health. I actually work for the Office of Public Health Preparedness, but I am representing the Medical Reserve Corps because we have a lot of volunteers that came in today to assist with assembling the face shields. So we have a lot of other partners that are involved in this. So it's not just Department of Health or not just Medical Reserve Corps.
Leilani Kahuano, Caring for Hawaii Neonates founder, and I'm part of this 15,000 Hawaii Face Shields assembly. So Hawaii Children's Action Network was looking for a coordinator, and so after waiting to see if anybody would step forward, we ended up stepping forward. So it's really a beautiful collaborative effort with Department of Health as well as Hawaii Children's Action Network, and then a number of other groups that really helped to make this time work. We've been very blessed with Hcan, Hawaii Children's Action Network.
Laura Devitt with Hawaii Children's Action Network. I am the Community Engagement and Training Director. DOH called up my boss, Deb Zeisman at Hawaii Children's Action Network, when they were needing face shields assembled. So they had, when they were trying to order and everybody's trying to get their stock in, the only way they could get them quickly was to order them unassembled, and so they contacted Hcan to see if they could help. And so Deb put the word out to a community Slack channel that we have going around COVID and public health, and Leilani stepped up, said she could help coordinate it, and then we got together a bunch of other community organizations and just came together and rounded up volunteers and space, and it's been a bit of a whirlwind.
So can you tell me some of the organizations that have pulled in volunteers for Hcan?
Faith Action, Hawaii Public Health,
The Hawaii Medical Corps. Leilani High School students came out, last week. Bricklayers Union.
We had labor unions, ILWU and the Riveters were here.
We've had the Boy Scouts of America today. The U.S. Coast Guard came out. Firefighters Association.
Hawaii Neonatal, which Leilani is with.
ILWU. We have High Five, which is one of our health organizations.
And so it's just nice to know that the community wanted to do something. There was a definite need of wanting to help. So I think a lot of people you're sitting at home and they don't know what to do, right? And they're following stay-at-home orders as they should, but there's still a sense of what else can I do to help my community.
They all got involved in helping us make these 2 weeks happen. So we actually had over 300 that reached out. And so today we had to cap it at a certain number due to COVID-19. But had that not been the case, we probably would have had 300 plus at NBC. I really want to give credit to the Neil Blaisdell Center and their staff and Mayor last week, because without their support and then understanding that this was an essential work that needed to be done to get these masks done for the hospitals, we wouldn't have been able to do it here in the way we did.
Well, thank you for your service. It's been beautiful to see the community together, and we really need volunteers like you to help coordinate all of us. Thank you very much.
Send them out here. Mahalo.
Mahalo.